Hi, and welcome to this Medicare 101 workshop, and congratulations on taking this step into better understanding how Medicare works and the options that you have. This is an educational workshop, so I will cover information that you need to know about how Medicare works, the costs involved, the parts you need, how to enroll, and how to avoid those lifelong penalties. But I'll not go into carrier-specific benefits or details. My name is Betty Brickhouse, and I am an independent broker, which means that my interest is in making sure you understand your options so that you can make the best decisions for you. I work for you, not the insurance companies, but I do partner with 10 different major carriers so that whatever you decide you want to do, I can help you enroll. I've been advising people on Medicare for 14 years, and I have to confess, it's confusing, and I learn something new every day. So my goal today is to unravel some of those intricacies of Medicare and leave you feeling more confident in your understanding of Medicare. So what will we cover today? We'll talk about mail, what to open and what to toss. The nuts and bolts of Medicare, who is eligible, when should you sign up, the Medicare alphabet and how original Medicare works, the two paths to coverage, what they are, and what the pros and cons are, when you can make changes to your Medicare, and finally, what will you spend on Medicare? So mail, what do you keep and what do you toss? If you're getting ready to turn 65, my guess is that this mailbox looks a lot like yours. It seems like everybody knows that you're getting ready to turn 65 and they want your business. Well, we're going to spend a little bit of time deciding what you can keep and what you can toss. So the Social Security Administration is the agency that determines your eligibility for Medicare. And they're the agency that you'll deal with when you're signing up for Medicare. You can sign up on the socialsecurity.gov website, or you can go to your local Social Security office, or you can call their 1-800 number to sign up. Once you're signed up for Medicare, you will deal with the Centers for Medicare and Medicaid Services. They're the ones who administer Medicare, and they will send you mail concerning what Medicare has covered for you and bring you updates on Medicare. And finally, the Department of Health and Human Services is that department that oversees Social Security and CMS. So any three of these logos, if you see on a piece of mail, I suggest you open it and you read it and probably put it in a file and keep it. But these are the three logos that you want to look at. There's going to be a lot of mail in your mailbox that looks like it's official, and it seems like it's official, but if you don't see one of those logos, I can guarantee you it's not official, and you can throw it away. What will happen is if you sign one of these cards and send it back in the mail, you'll get more mail and probably more phone calls. So this is an example of a letter from the Centers for Medicare and Medicaid Services. You can see there the logo for the Department of Health and Human Services. You can see that it says it's official Medicare, but they have that logo, and so that's your clue that this is something that you want to keep. It also tells you on the back that you can call that 1-800 Medicare number. So let's talk about Original Medicare, that program that started in 1966, and it's made up of two parts, A and B. Who is eligible for Medicare? Well, when you turn 65, your eligibility for Medicare typically begins if you are a U.S. citizen or a legal resident for 5 years, and you've had 40 quarters of work experience, or your spouse has had 40 quarters of work. You would be eligible for Medicare at age 65. You would also be eligible for Medicare if you've been on Social Security disability for 24 months, or if you've been diagnosed with ALS or ESRD. When can you enroll in Medicare? Well, your initial enrollment period happens when you turn 65. You can enroll 3 months before your birthday, the month of your birthday, or 3 months after your birthday. You can also enroll in a prescription drug plan or a Medicare Advantage plan during that time. If you are drawing your Social Security, you will automatically be sent your Medicare card. If you're not, then it's your responsibility to contact the Social Security office and enroll in your Medicare through Social Security. If you are still working when you turn 65, you can delay enrolling in Medicare with no penalty if you are currently covered or your spouse is currently covered by an employee coverage. If you are, you will receive a special enrollment period when you decide to retire and stop that employee coverage. That special enrollment period happens from the time your employee coverage ends for the next 8 months. But you only have 63 days to enroll in Part D. So my advice is don't put it off. Make sure you have your Part A and your Part B and any other parts that you want ready to go as soon as your employee coverage ends. If you miss your initial enrollment period or your special enrollment period, each year there's something called a general enrollment period where you can enroll in Part A and Part B. That's January 1st through March 31st. Typically, if you enroll in the general enrollment period, you've missed your initial enrollment period, and this is when you will probably have a penalty attached to your Medicare for the rest of your life. So that's why it's so important not to put off enrolling in Medicare either in your initial enrollment period or your special enrollment period. So the Medicare alphabet, it seems like everything in Medicare has a letter attached to it, so we're going to decipher that a little bit. Original Medicare consists of Part A, which is hospital insurance, Part B, which is medical insurance, and then Part D, which started in 2006, which covers prescription drugs. And we'll look into all three of those parts a little more closely. Part A is hospital insurance, and that covers inpatient hospital stays. So what is an inpatient hospital stay? Well, that's when the doctor has admitted you into the hospital. It's not when you're in the emergency room. It's not when you're in observation. That's outpatient. But an inpatient stay, you've been admitted into the hospital. And it's important to know that because Part A is what covers you. And it's going to cover things like the yummy food that you get, your hospital bed, any kinds of medications that are prescribed for you during that hospital stay. Medicare Part A also covers skilled care nursing if you've had a 3-day hospital stay. So what is skilled nursing and how does that differ from nursing home care? Well, skilled nursing is when you are in the process of getting better and you're getting skilled care, you're getting physical therapy or speech therapy or occupational therapy with the objective of going home. And nursing home care is more maintenance care where you no longer can take care of yourself at home and you're staying in the nursing home with no prospects of quickly going home from that. Medicare covers skilled nursing care. It does not cover nursing home care. Medicare Part A also covers hospice care. Hospice care is end-of-life care when the individual has been diagnosed to have a terminal condition, in which case Medicare pays 100% of care either in the home or in a facility to keep you comfortable in those last days. That differs from home health, someone who comes into the home who helps with bathing or dressing or cooking or that sort of thing, which is not hospice care, but more maintenance care. What are the costs involved with Part A? Part A has a hospital deductible of $1,632. And unlike many deductibles, that is a per episode of care. So an episode of care means you have entered the hospital as an inpatient. You've been home for 60 days. Once you've been home for 60 days, if you re-enter the hospital, that will be a new episode of care and a new deductible. Now let's turn to Part B, medical insurance. Part B is the heavy lifter of Medicare. It covers doctor visits, outpatient care, home health care, durable medical equipment like a wheelchair, a CPAP machine, preventive care, and there's a whole long list of preventive care that Medicare covers, like your vaccines, a flu shot or a shingles shot, a pneumonia shot. It will also cover mammograms, PSA tests, colonoscopies. Medicare is interested in keeping you healthy. What's not covered by Part B? Well, hospital visits and skilled nursing care and hospice care, because those are all covered under Part A. Dental, vision, and hearing are not covered by Medicare, although Medicare will cover vision if it's a medical issue like glaucoma, cataracts, but it will not cover routine exams and glasses. It also does not cover prescription drugs. That's Part D, which we will get to in a minute. So what are the costs of Part B? In 2024, the premium for Part B is $174.70, and that's monthly. For folks who are taking their Social Security, that will be directly taken from your Social Security check. If you're not drawing your Social Security yet, they will bill you quarterly. If you would like it billed differently, you can go on to mymedicare.gov and set up how you would like to pay it. There is also a $240 annual deductible. You pay that first, and then Medicare pays 80% and you pay 20%. If you are a high-income individual, you may pay more than the $174 a month. This chart gives you an idea of how that income is broken down. For example, a couple who is making between $206,000 and $258,000 could expect to pay $244 a month for Part B instead of the $174, and they will also be added an additional $1,290 to their Part D premiums. As you can see, it goes all the way up to $594, which is actually the full cost of Medicare. Everyone below that is getting a subsidy on their Medicare costs. Part D prescription drug plans started in 2006 to cover some of those high costs of medications. They are offered by private companies that are approved by Medicare and cover those medications that you get in the pharmacies. The way it is structured is there is a deductible phase. In 2024, that deductible phase is $545, where you pay the full cost of the medication until you reach that deductible, at which point you enter the initial coverage phase, where you pay a coinsurance or a copay for your medications depending on the tier that drug is in. When the full cost of your medications, what you pay and what the company pays, reaches about $5,000, you enter what is called the donut hole or the coverage gap, where you pay 25% of the cost of your medications. Once you've spent a total of $8,000, you enter the catastrophic phase, at which point you pay nothing for the cost of your medication. I know those sound like big numbers, but the true maximum out of your pocket that you will be responsible for in 2024 comes to about $3,300. That structure is changing in 2025, and there are a lot of changes that have happened in the last several years and on the horizon that we'll talk about now. So what's new and what's changed in your prescription drug coverage? Well, in 2023, Medicare began paying vaccines without copays and those preventive medications. They also put a limit on insulin at $35 a month. In 2024, people who have lower incomes could receive extra help up to 150% of the federal poverty guideline. They would receive full extra help, and they also eliminated the 5% co-insurance in the catastrophic phase. So once you reached that catastrophic phase, you no longer had any copay. In 2025, that maximum cap on prescription costs will be $2,000 instead of $3,300, and there will be an ability to smooth out your monthly payments. So if you have especially expensive medications, you can spread that out over the whole year instead of paying it all in those first few months. So what is the structure of Medicare Part D going to look like in 2025? Well, here's a sneak peek. The standard defined Medicare Part D coverage is going to have its initial deductible, just like this year, where you pay 100% of the cost of your medications up to the deductible, which in 2025 will be $590. So you pay the first $590, and then you enter the initial coverage phase, where you pay 25% of the cost of your medication. Once the total cost of your medication reaches $2,000, you'll enter the catastrophic phase, where you will pay zero. So you can see how that $2,000 maximum out of pocket is really going to protect those people who have very high medication cost. And what's on the horizon for 2026? The federal government has identified 10 medications that they are going to negotiate the prices on. This is a list of those 10, and there's some of the more common medications that cause problems. So we will see in 2026 what the results of those negotiations are. So that's Medicare, basic Medicare, A, B, and D. Now you have some choices in how you want to do your Medicare, and that's one of the reasons that it gets so complicated. So I'm going to try to simplify that now and lay out those two options for you: the pros, the cons, and the costs. Well, we'll start with the Medicare Supplement or Medigap plan. The way Medigap works is you have original Medicare, which is primary, which is making the decisions about what's covered and how much will be paid for those services. The doctor bills Medicare for those services. Medicare decides what's covered and what's not and how much is paid. Medicare pays its amount that they approve, and they send that on to your Medigap plan, which then pays the balance. It's a fairly simple structure, and it's a simple way it works. An important thing to note here is that Medicare must approve of the procedure in order for the Medigap plan to pay. So what is the small print? What do you need to know about the supplement in order to make a good decision? First, you must have Medicare A and B to enroll in Medigap, because Medicare is primary and it's the one making decisions about your health. 2, Medigap plans have no networks, no prior authorizations, and no referrals. Any place that takes Medicare will take your Medicare supplement. So you don't have to worry about checking first to see if the doctor takes your supplement. If they take Medicare, they will take the supplement. Medigap plans are all standardized. There are, of course, letters A through N, and there are a variety of ways that a Medigap plan can work, the G plan being the most comprehensive. It covers everything except Medicare deductible of $240. So a G plan is a G plan is a G plan. It doesn't matter who you buy it from. The benefits are standardized, and those are the benefits that you will receive. 4, the best time to purchase a Medigap plan is during your one-time 6-month Medigap open enrollment period. So that open enrollment period begins when your Part B begins, and it lasts 6 months after that. During that time, you can buy a Medigap plan with no questions asked, no underwriting, and you can buy it for the same price as anyone else, regardless of your health. Outside of that Medigap open enrollment period, you must undergo underwriting, and you're not guaranteed to be sold a policy. So if you have any significant medical issues, the time to get a Medigap plan is during that initial 6-month period after when your Part B starts. As long as you pay the premium for your Medigap plan, it is guaranteed renewable. They cannot cancel it for your usage. They are guaranteed that it will continue as long as you pay those premiums. Medigap does not cover long-term care. It doesn't cover dental, vision, and hearing, or prescription drugs, because remember, it only covers those things that original Medicare covers and that original Medicare approves. You cannot have a Medigap plan and a Medicare Advantage plan at the same time. You must choose one or the other. And finally, the price of a Medigap plan depends on your age, where you live, whether or not you use tobacco, the plan you choose, and the company that you purchase it from. So it's best to compare carefully those prices and coverage before you purchase it. These are the Medigap supplement plans that are available in 2024. There is an F plan and a C plan that are no longer offered if you turned 65 after January 1st of 2020. If you were 65 before then, those are an option. So you understand now why I used the G plan as the standard bearer, since it is the most comprehensive plan, covers everything except the Part B deductible. But there are other plans that are worth exploring, and I would be happy to go into detail with those with you. The other way of doing your Medicare is Medicare Advantage or Part C. A Medicare Advantage plan covers all the benefits of original Medicare and sometimes includes other things like dental, vision, hearing, over-the-counter, and prescription drugs. So what it does is packages original Medicare A, B, and D into a package where you just use one card at your pharmacy and your doctors. So what are the small print items that you need to know about an Advantage plan? Well, frequently there is no or low premiums. You still must pay the Part B $175, but often there's a zero premium in addition to that. Usually Medicare Advantage plans includes prescription drug coverage, but you must use their prescription coverage. Sometimes they offer additional benefits like dental, vision, hearing, gym memberships. 4, A Medicare Advantage is an alternative to Medicare. It provides all the benefits of A and B, but it's through a private carrier. So you still have Medicare, it's just that there's a private carrier administering your benefits instead of the federal government. 5, these plans have specific networks of doctors. They are managed care, HMOs, PPOs, a lot like your traditional work insurance. So you need to make sure that your doctor is in the network, that it takes that company, and you do need to be aware of those things and look into that before you purchase an Advantage plan. Some of these plans require referrals to specialists and prior authorizations for procedures. Although there is no monthly premium for Advantage plan, you pay as you go. So this includes a deductible sometimes. It includes co-pays for specialists, for tests, x-rays, hospitalizations, physical therapy. You pay for it when you use it. There is a maximum out of pocket to protect you from catastrophic costs. The maximum this year is $8,000, but some plans have lower maximum out of pockets. Benefits can change every year. So while they offer the dental, vision, and hearing and over-the-counter benefits and these sorts of things, they can change those from year to year. So it's a good idea to research that each year and make sure you have the benefits that you need and that you want. And finally, if you have a Medicare Advantage plan, it can be difficult to switch back to a supplement because remember, there's an underwriting process involved. And so they will look at your health, they'll look at your medications, and they have the option of selling you a supplement or not. So it could be difficult to switch from an Advantage plan into a G plan or any kind of Medicare supplement plan. So let's quickly compare Medicare supplements. So a Medicare supplement is added to original Medicare and it fills in the costs that original Medicare doesn't cover, the 20% and the Part A deductible. Medicare Advantage plans are approved plans with private companies that offer an alternative to Medicare. Medicare supplements don't cover prescription drugs from pharmacies. Medicare Advantage plans do. If you have a Medicare supplement plan, you would want to get a prescription drug plan to go with it. With a Medicare Advantage plan, it's all part of the package. Medicare supplement plans will cover emergency care with foreign travel. Medicare Advantage plan will cover emergency care, but often they don't cover emergency care during foreign travel. Medicare supplements do not cover routine dental, vision, and hearing, while Medicare Advantage plans do. They cover dental, vision, hearing, gym memberships, but again, those benefits can change from year to year. Medicare supplements cover most or all of your out-of-pocket expenses. So they have a higher premium, but your medical expenses are for the most part covered. Medicare Advantage plan has co-pays and co-insurances for services, so you pay as you go. A Medicare supplement plan's benefits are standardized and don't change. An Advantage plans can vary from year to year. Medicare supplements have higher premiums and fewer co-pays. Medicare Advantage plans have low premiums and more co-pays for services. Medicare supplements don't have any network restrictions. You can use them anywhere in the United States that takes Medicare. They'll take your supplement. And a Medicare Advantage plan has networks that you need to be aware of and that you need to stay within. Medicare supplements don't require prior authorizations, referrals. Medicare Advantage often do require referrals, especially with HMOs. To see a specialist and will often want prior authorization for services. So that's an overview of how these plans differ and what those differences are. So let's take a look now at when you can enroll in these plans. We've talked about your initial enrollment periods for Part A and Part B, but every year there is also an annual enrollment period during which time you can change your prescription drug plan or your Advantage plan. It's a good idea to reevaluate those plans every year because the plans change, the premiums change, the deductibles change, the copays change, the formulas change, and your medications change. And so you don't want to assume that everything will be the same the following year because that can change. The open enrollment period is between October 15th and December 7th, and I am happy to help you review that to make sure you don't have any surprises in January. There's also an open enrollment period for Advantage plans from January 1st through March 31st. During that time, if you have an Advantage plan, you may switch from Advantage plan to a different Advantage plan, or you can switch from your Advantage plan back to original Medicare and a prescription drug plan. So that's an opportunity if you change your mind after the annual enrollment period, you have that open enrollment period to change. So let's talk about how these two different ways of doing your Medicare differ in cost. So we'll look at the Medicare Supplement and Original Medicare first. And as a reminder, Original Medicare consists of Part A, which is inpatient stays, has no premium, but has a $1,632 deductible. Part B has a premium of about $175, a $240 one-time-a-year deductible, and then Medicare pays 80% of the cost, and you pay 20% of the cost, and there is no maximum out-of-pocket with Part B. A Medicare supplement comes in behind Medicare. It covers those gaps in Medicare. It covers the Part A deductible. It covers the Part B 20% copay. And you would also get a prescription drug plan to go with this. And the average cost of a prescription drug plan is about $30. It can range anywhere from 0 to 100, but the average is about $30. So if you have a Original Medicare and a prescription drug plan, you would be responsible for paying the premium for Medicare Part B, the deductible, $240 for Medicare Part B, the premium for the Medicare supplement. And at age 65 in Virginia, that will cost somewhere between $80, $90 to $100 a month. And then you would pay the premium for your Part D, prescription drug plan. And those are the parts you would need if you had Medicare and a Medicare supplement. So let's take a look at the Medicare Advantage plan, or Part C. With Part C, they package A and B and D into one package, and it is administered by a private company. There are local networks that you stay within. There are premiums, but many companies have 0 premiums for those. There are 5 companies who currently sell Medicare Advantage in the Lynchburg area. And you still must pay that $175 Part B premium if you have an Advantage plan because you still have Medicare. You would also have copays for services because you pay as you go. So you may have a $350 copay for a hospital stay for the first 5 days. You may have a copay for a specialist, for tests, for x-rays, for physical therapy. For when you use it, you have a copay. There is a maximum out of pocket, so there is a stop to how much you might pay out of pocket, and as I said, it's $8,000 this year. And it usually includes prescription drugs with their plans. So now we're going to do real quickly what those costs look like. So Medicare is $175 Part B premium. The average premium for a prescription drug plan is about $30. The average G plan is $90 to $100. And so when you add those up, it comes to about $300 a month, with the one exception of what the cost of your medicines are going to be. That's specific to everyone, so that is the only part of this that is a wild card, how much you'll spend on your medications. But we know in 2025, it's not going to be more than $2,000. You would add to that your $240 one-time-a-year deductible for Part B. So with an Advantage plan, you would still pay your $175 premium. The Part C premium is often zero. What the unknowns are is what your copays will be, how much you will spend on your medical services during the year, and how much you will spend on your medications. You have two wild cards here. You have the copays for services that you use. The maximum out-of-pocket is $8,000. Some plans have lower maximum out-of-pockets than that. And of course, the cost of your medications is the wild card there. So you know you will be spending $175 a month, but how much you spend for medical services over the course of the year and what you spend for medications is, again, a wild card there. And I hope that gives you a good overview of what the benefits are, what the costs are, so that you have an idea now which direction you want to go with your Medicare. If you would like to talk more specifically about your circumstances, if you would like to go through this for your individual needs, I am happy to help you. This is my contact information. Please give me a call, set up an appointment on my website, or send me an email. I'm so glad that you spent the time with us today, and I wish you well on your Medicare journey.